Today's video we are going to talk about what is vital signs. So vital signs are a group of 4 crucial medical signs that the status of our body's vital organs functions are noted. So by the measurement of vital signs it helps to assess the general physical health of a person. So by the assessment or measurement of vital signs a person's physical health is assessed. So the vital signs are pulse rate, temperature, respiration rate, and blood pressure. So come to the definition, that is what is vital signs. Vital signs are a group of 4 crucial medical signs that the states of our body's vital organs functions are assessed. So the main 4 vital signs are pulse rate, temperature, respiration, and blood pressure. So now come to what is pulse. So pulse is the palpable bounding of blood flow noted at various points of our body where artery passes over a bone. So the definition of pulse. So the definition is pulse is the palpable bounding of blood flow which is noted in various points of our body where the artery passes over a bone. So pulse are produced due to stroke volume ejected during systole and distension of the walls of the aorta. So pulse are produced due to stroke volume which is ejected during a systole of our heart and distension of the walls of the aorta, which creates a pulse wave as it travels rapidly towards the distal end of the artery. So pulse is generated due to the ejection of the stroke volume, means by each contraction of our left ventricle the blood is pumped through the aorta, so which is called stroke volume. So by the ejection of our each stroke volume during systole of our heart and distension of the walls of the aorta, which creates or which generates a pulse wave as it travels rapidly towards the end or distal part of our artery. Due to that, pulse rate is created. So normal pulse rate is 70 to 80 beats per minute and average pulse rate is 72 beats per minute. So the range is 70 to 80 and the average is 72 beats per minute. So next come to the factors causing variation in pulse rate. So which are the factors that affects the pulse rate? So the factors are age. So pulse rate is decreases normally with increase in age. So by the processing or by the advancement of our age, the pulse rate is decreases. So in infant the pulse rate is increased than the older age. So next is sex. A woman's pulse rate is about 5 beats faster than a man's pulse rate. So woman's pulse rate is more than the a main pulse rate, that is 5 beats faster than a means pulse rate. So then exercises increase in pulse rate. So in if a person is exercises, the person's pulse rate is increased than his normal pulse rate. So exercises aggravates or increases pulse rate. Next is pain and anxiety. So pulse rate increases due to pain and anxiety increases the pulse rate. Both pain and anxiety increases pulse rate. So next come to the various sites of our body where we can check pulse. So then there is 9 sites of our body where we can check or where we can palpate our pulse. So the sites are temporal, carotid, apical, brachial, radial, femoral, popliteal, posterior tibial and dorsal pedis. So there is 9 sites where we can palpate our pulse: temporal, carotid, apical, brachial, radial, femoral, popliteal, dorsal, posterior tibial and dorsal pedis. So next come to the another important vital sign, that is temperature. So body's temperature difference between heat produced by body processes and heat lost to the external environment. So what is temperature? Body's temperature differences between heat production by our body processes and heat lost to the external environment. So which is called our body's core temperature. So body's core temperature is the measurement between the heat production and heat lost. Heat production by the process of our body's normal mechanism and heat lost to the external environment. This is called our body's temperature. The normal temperature of our body, our we measure our body's temperature in three route, that is oral route, axillary route and rectal route. Mainly 3 routes are preferred. In oral route, the temperature is normal temperature is 98.6 degree Fahrenheit. In axilla, the temperature is 97.6 degree Fahrenheit, and in rectal, that is 99.6 degree Fahrenheit. So the highest normal temperature we can get from our body, that is from rectal, that is 99.6 degree Fahrenheit, and the lowest temperature where we can the normal lowest temperature from our body we can get from axilla, that is 97.6 degree Fahrenheit. And there is the factors that affect our body's normal temperature, that is age. By increasing our age, there is decrease in body temperature. In case of sex, women have higher body temperature than men. And in exercise, during physical activity, there is increase in body temperature. And stress, there is increase in stress, there is increase in body temperature. So those are the factors: age, sex, exercise, stress. Those are the factors which have affect the normal body temperature.